Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know very well that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. So today is a continuation of the serial that is Ayurveda in GP or Ayurveda in general medical practice. Actually, this topic is very common nowadays because of the inflammation of the mucous membrane of the mouth that is called as a stomatitis. Here you can see ITIS indicates the inflammation. And whenever there is inflammation, according to Ayurveda, that is basically a pitta dosha problem. So, whenever the person is having pitta prakopak ahar and vihar, that means pitta vitiating foodstuff and also the lifestyle, then definitely the body heat get increased, and this type of stomatitis, or in Ayurveda it is called as a mukha pak. Mukha pak starts, and after this continuation of this stomatitis, sometimes the complications like aphthous ulcers also develops. So there are ulcers on the inner side of the lips or inner side of the cheeks, and the patient cannot eat properly. He has a lot of pain, lot of irritation, and that makes the life miserable. Actually, it is not a serious disease, but it makes the person's quality of life a little bit bad. And if it is occurring recurring, then that's a more and more problem. But let us see what are the causes, what are the investigations that we can do in this particular stomatitis problem. So, my dear friends, causes are the first catarrhal stomatitis. For you to concentrate on the topic, I will mark a little portion. So here you can see, usually it is a secondary. Basically, some other diseases are there. For example, local causes, poor oral hygiene, that means not cleaning properly with the danta dhavana, teething or the brushing the teeth, and also the cleansing the tongue. So gargling, mouthwash is not there. So excess use of the tobacco, alcohol or spices, a lot of chili substances, hot substances, too much tea, too much coffee, too much alcohol, too much smoking, too much tobacco, everything is provoking it. So use of broad spectrum antibiotics and the medicines like iodides or the gold, all these can cause the stomatitis problem. General whole body consideration, debility by any disease, especially the autoimmune compromised diseases. Like for example, there may be rheumatoid arthritis, there may be systemic lupus erythematosus, or some other diseases, chronic diseases, like for example, tuberculosis. Then there may be HIV problem, cancer problem. So all these give a lot of weakness and debility, your body immunity goes down, and stomatitis starts. Severe infections sometimes that can also, viral infections can give rise to the stomatitis problem. Now let us talk detail about which type of the infection can cause this type of the complaint like stomatitis. Bacterial infection like Vincent stomatitis. Predisposing factors, of course, are tobacco, smoking, pre-existing non-specific inflammation of the gums, that is gingivitis, or local trauma while brushing or cleaning in association with acute physiological disturbance, which may precipitate the disease in the sensitive patients, susceptible individuals, especially the person is already having pitta pradhana prakriti according to Ayurveda, pitta dominant prakriti or pitta vata prakriti. These people always suffer if there is a Rakta Dhatu Sarata is not good. Sarata is a tissue quality examination. In Ayurveda, Rasa Rakta Maus Med Asti Majja Shukra, each Dhatu can be examined by for quantitative matter or for qualitative matter. That examination method is called as Dhatu Sarata Parikshan. So here you will get Rakta Dhatu becomes Hinasar, low quality. Then viral primary herpetic gingivostomatitis, then fungal infections like thrush. This is a little bit dangerous. Pseudomembranous candidiasis, fungal infection, occurs maybe in infants or debilitated adults, such as the heroin addicts, the elderly, and the patients being treated with corticosteroids, Visolon tablet. Uh, that means uncontrolled use of prednisolone or visolon, no tapering of the medicine. Sometimes the doctor prescribe corticosteroids, like for example, prednisolone or the visolon. Visolon is a brand name and prednisolone is a generic name. Actually, 10 milligram tablets, it has to be given for rheumatoid arthritis, controlling the acute pain, glomerulonephritis, or the problems with the kidney. So these type of autoimmune diseases, doctor prescribes steroids, but in a specific manner for limited period. If the patient goes on continuing that particular tablet without control of the doctor, then that can cause havoc. Remember my words. So corticosteroids are good as well as bad. Next, uncontrolled use of antibiotics. Then there are another causes for the stomatitis. For example, we will start to discuss these problems. Aphthous stomatitis or chancre sore. Etiology is not known. Probably cell-mediated immunity weakness to oral mucosa antigens often follow the periods of emotional stress. So mental stress is always behind that your stomatitis problem. Vitamin deficiency, especially raw beef or raw red tongue in nicotinic acid deficiency, angular stomatitis and cheilosis in riboflavin deficiency, drug-induced methotrexate and other folic acid antagonist. Antagonist means opposite to folic acid may cause stomatitis. Allergic stomatitis caused by the local application of antibiotics or rarely by chemicals in the denture and toothpaste. Local manifestation of the disease, it may be stomatitis can be a manifestation of skin disease like lichen planus, very rarely, pemphigus vulgaris, rare, erythema multiforme, and systemic diseases, syphilis, venereal disease in secondary stage. My dear friends, let us talk about the investigations, what we can do for the stomatitis patient. Simple test, hemogram and ESR to rule out acute or chronic infection and anemia. When hemoglobin normal, 12 to 14 gram percent, if it is below 10 gram percent, mild anemia, below 7 gram percent, moderate anemia, below 5 gram percent, admit the patient. Severe anemia, anytime cardiac arrest. Infection, WBCs are important. Normal white blood cell. These are the soldiers. Count is 4 to 11,000 per cubic mm. 4 to 10,000, 4 to 11,000. If that WBC count goes to 15,000 per cubic mm, mild infection, 20,000 per cubic mm, moderate infection, more than 25,000, oh my God, severe infection. So this is a clear-cut idea about what is infection. VDRL, that is for venereal disease, when the person is visiting to prostitutes or the girlfriend without doing the sex, without unprotected sex, then he can get syphilis, gonorrhea, chancroid. I have the separate videos for these problems. Please look for that. Ulcer swab, here if it is ulcer, swab culture to detect the pathogenic organisms. Now let us talk about the treatment for stomatitis. First, if you are having some idea of specific cause, Sanshepatah Kriya Yogo Nidana Parivarjanam. Try to remove the cause, try to avoid the cause, try to treat the cause, basic cause. For aphthous stomatitis, home remedy, chew washed jasmine leaves like that, like this. Okay. Then medicines, local application of smiley gel, just cooling effect. Pravala Bhasma, this is Pitta Gna. You have to treat as a Pitta Vikar, Pitta diseases, and anti-Pitta treatment should be given. Pravala Pishtivati, 2 tablets 3 times in a day. Chavanaprash, vitamin C, immunomodulator, immunobooster, 2 teaspoons 2 times in a day. Avipatti Karjurna, whenever Pitta problem, your stools must be clean. Every day morning, good morning type of stool. There should not be constipation. Constipation always makes any problem worsening, but Pitta problem more and more bad. Why? Why does this happen? Because of the constipation, heat is not going out properly. So heat is accumulated in the body, and if there is already problem of the pitta, it get flares up. So Avipattika Churna is the best laxative to make your stools perfectly all right in the morning. 1 teaspoon with warm water at bedtime. Now Pathya regimen, always check. Just now I have explained that. Regular bowel movement should be there. Normal stools every day morning. No constipation. Get rid of all the mental stress factors. Stress management. Om, pranayam, meditation, shavasana, everything is good. Okay, even Shirodhara to get mental stress, relax. Full body oil massage, very good. Be particular about the wholesome diet. There should not be vitamin B complex deficiency or vitamin C deficiency. If you feel like that, you can get a what you can say, the Biplex Fort tablet, even of allopathy, no problem. Biplex Fort, only one tablet daily. Tablet Celine, CELIN, only one tablet of 500 milligram. Okay. Avoid late nights. Keeping late at nights increase the heat. Increase the heat. Quit all the habits like for smoking, drinking, tobacco, etc. Special instruction for habitual stomatitis. Repeated. Take butter ghee or medicated ghee, especially Dadimadi Ghrita. Please write down. Dadimadi Ghrita in increasing manner. For example, first 2 days, 50 ml. Then next 2 days, 100 ml. Next 2 days, 150 ml. And then after completing that, that is like a snehana. You can do the blood donation, which is like a rakta mokshana, which is the best treatment for pitta dosha problem like stomatitis. Stomatitis due to fungal infection. Then you have another Ayurvedic oil, which is called as Irimedadi oil. Apply locally 3 to 6 times in a day. And that is all for the discussion about the stomatitis, which is a common problem. It is not really serious, but giving so much trouble that the patient always needs some advice. Thank you very much. Please like, share, and subscribe my YouTube channel, and see you in the next video. Till then, keep healthy and happy for yourself. Thank you very much. Thank you, love.